We are back on Morning Line. I keep picking her brain during the commercial breaks. Noreen Gibbens is with us. She's a doctor of audiology with Middle Tennessee Audiology. I know a lot of you just sitting there listening, and I hope you can hear us. 737-7587 if you want to join in the conversation. But I was asking her just about the basics of getting one of these bundled packages or whatever. The initial expense for hearing aids can be intimidating to a lot of folks.
Yep.
And as you said, you can unbundle them, and there's a whole range up to probably $6,000 to $10,000. If you want some gold standard, to maybe on the very lowest end can be a few $100. I don't know. But once you get that initial outpouring of money, is there a lot of spending on maintenance after the fact?
It depends on your ability to take care of the device.
Okay.
There's three main reasons that they break down. The first two are wax or dry skin getting into the receiver. And
Can you teach us how to clean it?
Absolutely. Yep.
So if you're willing to do this, and I know you may have some elderly patients that can't do as much.
Correct.
But someone like me, if I get one in the next few years, I mean, if you can show me, I'm pretty sure I can figure it out.
Yeah, for a lot of people they can, and the hard part is for us to predict. One more thing that causes them to break down a lot is moisture and humidity.
Okay.
And so we have to take that into account.
So if I'm going swimming, take it out.
You got to take it out.
Take it out in the shower.
Make sure your hair is dry before you put it back on. Yeah, you do, and even just day-to-day life in Tennessee in the summer can create a lot of problems.
Are there some more hardy than others, though? That
there
can
are
take more
some
of a beat?
that are definitely more hardy. Yep, they're designed. Remember, the same people that wear these devices, the children are going to wear them as well, and they're particularly hard on hearing aids.
Well, is there one a scuba diver could wear?
No.
Nope. I'm just wondering if it's to that degree.
Yeah.
There's nothing waterproof like that.
There's nothing that I would recommend for scuba diving.
Okay.
Or, yes,
and it's not like you're going to be talking underwater all that much.
Right.
What about insurance? Does insurance come into play, or what kind of condition would you perhaps have to do to get some insurance coverage? How does that play?
What we're starting to see is some of the Medicare Advantage plans are starting to have some sort of discount program available, and that a lot of people are taking advantage of that. That's been wonderful to see how it's opened the doors. I saw two yesterday that are definitely taking advantage of it and have not been able to wear hearing aids before. They're very happy to be able to do this. So we see that going on. There are more and more health plans that are recognizing, again, that need. So we would always suggest that you check, or we will check for you to see what sorts of coverage might be available. It's extremely variable. When I was in Michigan, there was a lot of third-party coverage through the health plans, because in Southeast Detroit there was a lot of unions that had that built into their benefits, but there was also a lot of noise exposure. And so there was recognition that that needed to be taken care of.
I'm just wondering if my policy here at Channel 5 even covers for something for hearing loss. I don't know. I haven't gone there. But I mean, typically do most private policy plans like that? Have you found, they may have a right. I'm guessing mine does not. I don't know. I mean, they cover different things. But
no.
Typically no?
No, typically no. But I've been surprised at some that have had good coverage. So until we check, it's hard to be sure. Okay,
and I'm wondering about conditions. Now, of course, rock stars like Pete Townsend and others from The Who. Is it tinnitus? Tinnitus. Is that a ringing in the ear from just, it's always there because you've damaged your eardrum?
It's a ringing or a buzzing. It can be any sound that's not externally produced. So it's something you're hearing that isn't perceived by others around you.
You know how sometimes you're at home and you're going to bed and it's quiet at night and you just kind of hear like a very light white noise. It's nothing bad with me, but it's almost like there's something there.
Yeah.
So what would that be from?
It's, well, this is another area of study that's very interesting. They took a group of college students with no history of hearing loss, no history of any noise exposure that they could verify, and put them in a sound booth for 20 to 30 minutes at a time. 90% of those college students walked out saying, yeah, I heard some sort of tinnitus or something there.
Is that just because the world we live in is noisy?
It's the world we live in, but actually our body produces a lot of noise, and it's blood flow, breathing, you know, all those things create some noise. But there is a theory that all of us have tinnitus. Something makes it loud enough that we detect it. That's one theory. Tinnitus is very hard to study because animals are typically where we do the research, and they're not good at telling us when they have ringing,
right.
so
Right.
that's a challenge. It's more, we don't really know what causes it.
So can that be cured or no? I mean, Pete Townsend, again, these rock stars that have been playing for years in front of huge speakers, that's pretty much permanent damage, isn't it?
It is permanent damage, yes.
So you can still hear, maybe, talking, but this background sound is always there.
Correct, yes. There are certain frequencies that are most important for understanding speech, and oftentimes, unfortunately, high frequencies are affected first with noise exposure. Those are the most important. I call it the triple whammy. They're the most important signals. It's where the speech is for understanding, the consonants and that sort of thing. And then also that's where more hearing loss is.
Right.
So tinnitus is one of those things that in some ways might help us to get people exposed to noise to understand the importance of using hearing protection. When I was at this conference over the weekend, somebody said, you know what I do when I'm trying to get the point across is I just turn on a 4,000 hertz tone and play it at about 80 dB in the room, and I won't turn it off until somebody starts saying, can we get rid of that? And she says, this is what I try to explain to them will happen, because sometimes explaining to people that a hearing loss is going to be an issue 20 years from now is hard to make that message. But tinnitus is a whole other story. It's pretty bothersome for some people.
Oh, I can imagine.
Yeah.
We have another caller on one. Let's go to V. Good morning, V.
So I've had issues with hearing on my right ear all my life.
Okay.
And basically wanting to, well, I had 3 surgeries where I'm not sure what it's called. They take a drum, basically a tissue out, and then they make an eardrum for me. And so I have no hearing out of my right ear, but I hear just fine on my left ear. So I'm wondering, should I go ahead, I'm 40, should I go ahead and start looking into wearing a hearing aid on my right ear, or should I wait till I get older?
I would say sooner is always better, and I think the surgery you had was called a tympanoplasty. It is something where often, we run the risk that there won't be any usable hearing in that ear. There's a device called a BAHA, which is a bone-anchored hearing aid. It's a surgically implanted device, and that would be one of the things I would suggest you talk to an otologist about. Ear, nose, and throat doctors are specializing, of course, in all issues related to ears and nose and throat. Otologists specialize in ears alone, so they are the surgeons. They have a great program here at Vanderbilt and also at Nashville ENT. If there's others, I apologize, but those are the programs I'm most familiar with. And they'll do an evaluation to see if you're a BAHA candidate, which is something to think about, but there's also a device called a cross hearing aid that would pick up sound on the ear with no hearing and send it to the better ear. So I would definitely look into that, because it would probably help make life easier for you.
Yeah, why did you lose hearing in that left ear?
Not sure. Early age, I had a lot of ear infection, but they never knew why I lost the hearing. Maybe that's related. I'm not 100% sure.
Yeah,
Gotcha, that's interesting.
Yeah, there might have been something called a cholesteatoma, which occurs when there's multiple ear infections.
Yeah.
It's a growth in there that they have to go
I
in
had
and...
tons, a lot.
Oh, boy.
The question about the BAHA that you were speaking of, is it inside your ear or is it outside?
It's outside the ear. It's actually device. It's going to sound really strange, so don't let me scare you away. It's a little bit of a screw implanted in your skull, but that sounds horrible, so don't let that deter you. It's a little device that's worn outside and on a little bit to the back of the ear. It's very...
Awesome. Thank you so much.
You're welcome.
It's interesting.
Have a good day.
Thank
You
you, ma'am,
too.
for your call. That was interesting. So if she's lost all the hearing and it can't be anything more out of her left ear, but you're saying, because you're right, there's things that may happen on her left side of her body where you can have something on this side that then transmits to the hearing aid here. So at least, how will she know that sound is coming from her left when that happens?
It's very difficult to localize sound when you only have hearing in one ear. There's definitely reasons we have 2 ears, and it makes it a whole lot easier. But The Baha device, I've been told with some people over time they can tell. There's a little bit of a delay in sound getting over it, but Baha, it's transmitted through the bones of the skull. With a hearing aid, it's through an FM signal. So there's different ways of doing that.
And you know what? You don't really, in some instances, it would be good to know it's coming from that side. But if you're just having a conversation, I don't care which ear it's coming from. I just want to be able to hear it. And if you have someone on this side of you kind of whispering, and you normally wouldn't be able to hear, but you can overhear it, that's nice.
It is nice. In fact, it was a study done, by the way, at Vanderbilt. I'm a Vanderbilt graduate.
Okay. Proud Vandy grad.
They did a really interesting study on children with unilateral hearing loss, because years ago it was thought, oh, at least you have one good ear. It's not too big of a deal, right? And they found that children with unilateral hearing loss were 50% more likely to have failed a grade. And that was a number that got everybody.
Because they're just not hearing everything.
They're not hearing, and it often
tough.
looks like a behavioral issue because they're not, they're not attending well. Unilateral hearing loss is a very big challenge for people.
Wow. All right, let's go to Brian. Hi, Brian.
Hey, good morning.
Good morning.
Hey, as you get older, I've noticed that, I don't know, I've had my hearing checked. I live out in the country at a local clinic that I pay pretty cheap for. But as I got older, my lady friend says, it seems like I don't know if I'm missing things, I'm hearing things, but occasionally I'll hear something, but I'll hear it, I don't know, the wrong way. And I had it checked, and they said there's nothing in there. And I don't know exactly what it is, but I don't know if it's just maybe as I'm getting older, I'm not, sometimes I'm not ignoring people, but just not paying attention to what they're saying. Or is that something that as you get older, you don't hear things the way you should, or how does that work?
Well, if there's any high frequency or high pitch hearing loss, it can certainly affect the ability to understand, because again, those are the consonants that are so important. But also, too, if again in the late 20s to early 30s, we do lose some of our ability to process speech in noisy or difficult environments. So it is more of a having to work harder to hear and understand, even in the presence, even without any hearing loss present in those areas. So that is something we always need to make people aware of, is that someone getting your attention first, your lady friend or friends, I'm not sure what you said there, so having them get your attention first is really important, and think about the environment. We tend to be multitasking more often than we realize sometimes, and attention is a big issue when it comes to hearing. We can all detect things or hear things and completely ignore them. I don't want to say you're purposefully doing that, but if we couldn't turn off some of the sound around us, we'd really have challenges in everyday life with all the things going on. But someone getting your attention first is huge. So them calling out your name, and then you're going to turn and look, and that's going to make use of the little directional devices we have on our head called our pinnas, or our external ear, pick up high frequencies better. So there's all sorts of good things that happen when you know someone is trying to engage you in a conversation.
Gotcha. On that note, let's take a quick break. More of our phone calls with our guest in our final segment right after this. Stay with us.